Good day everyone. So for today's video, I am going to assess from head to toe. So first is the preparatory phase. Reassess the client's previous medical records if available. This is to establish guidelines for the content, maintenance, and the confidentiality of the patient. So next is to determine the scope of the assessment needed, prepare necessary equipment. It is to gather relevant information while the patient seeks medical health care, and having the equipment available saves time and energy. It also facilitates accomplishment of the procedure. So next is to perform hand washing and don gloves. So this is to prevent the spread of microorganisms, um, and and the gloves protect the nurse against from exposure to blood or bodily fluids. So I am going to use alcohol-based hand rub. So next is to assemble equipment and supplies needed. This is for organized work. This is for organized workplace. Easy access of the equipment you will be needing. So here I already prepared my equipment. Then introduce self and verify the client's identity. This is to ensure that the right patient will be assessed and to help prevent errors. This will also serve as a good way to establish rapport with the client. So good day, ma'am. I am your student nurse for today. I am Mr. John Ryan S. Baco. So may I know your name, ma'am?
So I am Miracle May Polastico,
And your age, ma'am?
21,
Birth date?
June 23, 2000.
Okay, ma'am. Thank you, ma'am. Then explain the procedure to the client. So explanation helps relieve and allay anxiety. It also facilitates cooperation. So ma'am, today ma'am, I am going to assess you from your head to toe. So ma'am, I will be needing your full cooperation so everything will run smoothly. Thank you ma'am. Then ask the client to empty the bladder before beginning the examination. So this is to eliminate bladder distension and interference with an accurate examination. So ma'am, do you want to urinate ma'am?
Yes, sir, please.
You wait.
Okay.
Then position the patient comfortably and provide privacy. This is to ensure that the client's comfort as well as secures client's privacy and confidentiality. So ma'am, are you comfortable with your position right now?
Yes, sir.
Okay ma'am. So now let's proceed to the assessment phase. So first procedure is to observe appearance, specifically the skin, grooming, the body build, and behavior. Okay. Normally, client's physical appearance is congruent with the age and sexual development that should be seen with the client's age. Moisturized and fair skin, lighter on the unexposed area than the exposed one, have overall proper hygiene on body. Client's name in looking is looking presentable with no noticeable body odor. The client doesn't show unusual behavior and any mannerism. Also, the client acts in accordance to her age. So now let's assess the vital signs. So first is the temperature. So ma'am, I will be assessing your temperature, ma'am. So ma'am, kindly raise your sleeves, ma'am. Thank you, ma'am. So 36.5. So normally the client's temperature is normally the client's temperature is 36.5 degrees Celsius. So now let's go to assessing the pulse and the respiration. So ma'am, I will be getting your pulse rate, ma'am. Okay, ma'am. So normally the client's pulse rate is 75 beats per minute in rest phase, and the respiration is normally the client's respiration rate is 14 breaths per minute. So now let's go to the blood pressure. So now ma'am, I will be getting your BP, ma'am. So can you please over here, ma'am? Is that okay, ma'am? Okay, ma'am, I will start. Okay, ma'am. So normally the client's blood pressure is 110 over 180, 110 over 80 mmHg. So now let's go to the pain. So ma'am, do you feel any pain, ma'am, or any discomfort right now, ma'am?
No, sir.
Okay. So the patient reports no pain and discomfort. So now let's proceed to taking the body measurement. So ma'am, I will be going to take your height and weight, ma'am. So let's go over there, ma'am, to take your height and weight. So the height is 4'11", and your weight, ma'am, is 45 kilograms. So now I will be taking the waist and hip circumference and the mid arm circumference. So ma'am, can you stand up for a while, ma'am? I will be taking your first your hip. Okay, then your waist. Ma'am, wait, I will just list it. Next is your okay, ma'am. So you may now sit down, ma'am. So now let's go to the tricep skin and tricep skin fold thickness. So I will be taking your skin okay, ma'am. Okay, ma'am. Then calculate the body mass index. So, ma'am, having your height of 4'11" and your weight of 45 kilograms, so your body mass index, ma'am, is 20, which belongs to uh, normal, ma'am. So now let's go for the mental status examination. So first, let's observe for the level of consciousness. So, ma'am, may I ask your name again, ma'am?
So again, I am Erica Polastico.
Where do you currently live right now?
So I am currently residing at Buracuan in North Poblacion, Maramon, Bukidnon, sir.
Okay, thank you, ma'am. So, normally the client is conscious, alert, and awake. So, next is the posture and body movement. So, ma'am, can you sit normally, ma'am, like ma'am? Then, can you stand up, ma'am? And stand still, ma'am? So, can you just take a normal walk here, ma'am?
Okay.
Okay, ma'am. Okay, ma'am. Relax it lang, ma'am. So normally the client enables to move every part of the body freely, can stand, sit, turn, and lay down properly. So next is the facial expression. So and also the speech. So as I was interviewing our client lately, the client maintains eye contact. Also, she smiles and responds to my questions appropriately. Then, excuse. Then, normally for the speech, normally the client can speak clearly and understand every and is understandable. Uh, she is unable to talk properly. Next is the mood, feelings, and expressions. So, ma'am, how are you feeling today, ma'am?
So I feel happy today, sir.
So, ma'am, can I ask you a question, ma'am? So, what are your future plans, ma'am?
So akong plano for the future is to maguman ko eskwela and to work abroad and to have a happy family.
Okay, ma'am. So, normally the client is cooperative or friendly, expresses feelings appropriate to situation, verbalizes positive feelings regarding others in the future, expresses positive coping mechanism. Next is the thought process and perceptions. So, um, so ma'am, can you tell me more about your future plans, ma'am?
So sa kong ingon niya, maguman ko og kining eskwela and to have to work abroad and to have a happy family and also to have a lots of business and to help other people.
So, do you really like business, ma'am? No?
Yes.
So, what kind of business, ma'am?
Um, restaurants, clothing line.
Okay, ma'am. Thank you, ma'am.
Okay.
So, the client expresses full, free-flowing thoughts, follows directions accurately, expresses realistic perception, is easy to understand and make sense, does not voice suicidal thoughts. Now let's proceed to the assessing of cognitive abilities. So, orientation to person, time, and place. So, ma'am, can you tell me your family members, ma'am?
So, ang pangalan sa akong mama kay si Eileen Badilla, sa ako ang papa is Randy Badilla, sa ako akong sister nga isa is Ranilyn Badilla, and amo ang pinakamanghuran kay si Realyn Badilla.
Okay, ma'am. So, can you tell me, ma'am, if where are we right now, ma'am?
So, we are here at the clinic, sir.
So, can you tell me the date, ma'am?
So, it's July 25.
Okay, ma'am. So, the client was able to tell all the correct answers. Next is the ability to focus and allow direction. So, ma'am, please, can you pick up the pencil, ma'am, with your left hand and put it on your right hand, ma'am. And can you hand it to me, ma'am? Thank you, ma'am. So the client can follow directions and is very focused. Next is the recent memory of happenings today. So, ma'am, what did you eat lately, ma'am?
So, for breakfast, I ate oats with honey, and for lunch is chicken.
Okay, ma'am. Thank you, ma'am. Uh, the client can recognize some event past a few hours and days. So next is the remote memory of the past. So, ma'am, when is your birthday, ma'am?
So, last June 23, sir.
Okay. So, the patient can distinguish some certain memories. So, next is to recall of unrelated information. So, ma'am, do you know who is our president right now, ma'am?
It's Rodrigo Roa Duterte, sir.
Okay, ma'am. Um, Next is the abstract reasoning. So, ma'am, I am going to ask you a question, ma'am. So, how are the apple and orange the same, ma'am?
So, they are both fruits, sir.
Okay. And how are they different?
By their taste and the colors, sir.
Okay. Next is judgment. So, ma'am, may I ask you, ma'am, so what do you do, ma'am, if you experience pain, ma'am?
So, I usually mag puyo lang ko sa balay and matulog lang din ko, sir, din mag-inom ko medicine.
Okay. So, next is the visual, perceptual, and constructional ability. So, ma'am, I would like you to draw, ma'am, the face of one thing. So, the client did draw the clock as it is. So now let's go to the physical assessment. So first is the skin. So assess the skin color, variation, texture, temperature, turgor, edema, and lesions. So ma'am, I am going to assess your one ma'am skin. So okay. Okay ma'am. So there are tan lines in parts where the shirt hems ends. The parts not exposed were much lighter, but overall skin color ID uniform with no apparent discoloration. So also smooth texture, even and well maintained skin, intact and no red areas present. Skin temperature is warm. Client has good third sign of being well hydrated, and no edema is present. So next is the head and face. So inspect and palpate the head for the size, shape, and configuration. So, ma'am, I am going to inspect and palpate your face, ma'am. Ma'am, and I'm going to palpate. Okay. So the size, shape, and configuration of skull is good, free from lesions and pink immobile, absence of bulges, projections, and tenderness. So next is note for consistency, distribution, and color of hair. So ma'am, I'm just going to check your hair, ma'am. Okay, ma'am. So the hair is not too dry or oily. No sign of alopecia, and it is brown. Um, bra, the hair is black in color. I'm sorry. Evenly distributed with no infestations and bald patches. So next is to observe for symmetry, facial expressions, and skin condition. So so can you smile, ma'am? Ma'am. So facial features and movements are symmetrically. Um, Also, skin condition have a good elasticity, no edema and discoloration present. Client's left eyebrows are both symmetrically aligned and moves equally when asked to raise or lower. Next is to check for cranial nerve 7. Have the patient smile, frown, show teeth, blow out cheeks, raise eyebrows, and tightly close eyes. So, ma'am, can you do what I tell, ma'am? So, can you smile, ma'am? Okay, and can you show me your teeth, ma'am? Then, can you frown? Puff cheeks, ma'am. Then, raise your eyebrows. Then, close your eyes.
There you go. Then,
Close your eyes. Then, open. Ma'am. So, client can do any facial movement and expression. No any sign of depression based on observation. Next is to evaluate function of the cranial nerve 5 using the sharp and dull side of a paper clip. Test sensation of forehead, cheeks, and chin. So, ma'am, here I have a clip, ma'am. So, can you face over here, ma'am? So, I am going to pick you with this hair clip, ma'am. So, can you tell me, ma'am, if it is dull or sharp? So, I want you to close your eyes, ma'am. And also tell me, ma'am, where did I pick, ma'am?
sharp here. Dull here. Sharp here. Dull here. Sharp here.
Okay, ma'am, you can open your eyes. So, client was able to feel the object I've been using on her forehead, cheeks, and chin, meaning her facial nerve is intact and functioning well. Next is to palpate the temporal arteries for elasticity and tenderness. So, ma'am, I am going to palpate your temporal bone. Okay, ma'am. So, there are no tenderness felt. Next is to palpate the temporomandibular joint. This is for tenderness, swelling, and crepitation. So now I'm going to palpate your temporomandibular. So now can you open your mouth, ma'am? Close, open, then close, ma'am. Thank you, ma'am. The temporomandibular joint move freely and reported painlessly. Absence of tenderness, swelling, and crepitation. Next is the eyes. So, determine the function of the following. First is to test vision using the Snellen chart. So, ma'am, I want you to stand up, ma'am. So, do you see that Snellen chart over there, ma'am?
Yes, sir.
So, ma'am, I want you to tell me, ma'am, what I am pointing, mama. So, can you cover your right eye, ma'am? So, what is this, ma'am?
E,
This,
F,
this,
P,
and this.
Z,
Okay, ma'am. Cover your left eye now, ma'am. Again, ma'am, what is this?
E, P, T, Z.
Okay, ma'am. Ma'am. So, can now sit down now. So, vision from 20 feet away is normal. So, next is to test visual fields. So, okay, ma'am, I want you to stand up again, ma'am, and position yourselves over there. So, look at me, mama. So, can you cover your right eye, ma'am, as I cover my left eye? So, do you see this, ma'am?
Yes, sir.
So, just follow it, okay?
Okay, sir.
The other eye, ma'am. Okay, ma'am. So, can you sit down? So, there are no irregularities was noted. Next is to assess the corneal light. So, ma'am, I want you to face over here, ma'am. So, let's just assume this is a pen light. So, just look straight at me, mama. So, don't look at the light, ma'am. Okay, okay, ma'am. So, both eyes are constricted and has consensual response. Next is to perform cover and position test. So, ma'am, can you straight directly over there, ma'am? So, okay, ma'am. Okay.
Nagulat. Okay,
Okay, ma'am. So, the uncovered eye should remain fixed straight ahead. Then, the covered eye should remain also fixed straight ahead after being uncovered. Next, inspect external eye. So, position and alignment of the eyeball in the eye socket. So, ma'am, I'm just going to inspect your eye now. Okay. So, the eyeball is properly aligned in the eye socket. Next is the bulbar conjunctiva. Um, um, so, ma'am, can you face over here, ma'am? So, I'm just going to check your bulbar conjunctiva, ma'am. Okay. So the bulbar conjunctiva is moist, smooth, clear, and no signs of conjunctivitis. Um, Next is the palpebral conjunctiva. So, ma'am, can you look up, ma'am? Okay, ma'am. Okay. So, it is free from lesion, swelling, and foreign bodies. It is observed clear. Next is to invert the eyelid to assess the palpebral conjunctiva and the oculomotor nerve. So, ma'am, I'm just going to invert your eyelid, mama. Okay, okay, the other one. Next is the lacrimal apparatus. So, okay. So, ma'am, I'm going to palpate your nasolacrimal, ma'am. Okay, ma'am. So, there are no swelling or redness over the areas of the lacrimal gland. Puncta is visible and no drainage is observed. Next is the cornea, lens, iris, and the pupil. So, ma'am, can you face over here, ma'am? Face directly at me, mama. Okay, ma'am, yes. Okay, ma'am. All are of normal findings. So next is to test for papillary reaction to light. Okay, ma'am. Again, ma'am, face directly at me, ma'am. Okay, the other one. Okay, ma'am. Position. So, both eyes are constricted and has no and has consensual response. So next is to test for accommodation of the pupils. So ma'am, can you see this object, ma'am? So I want you to look directly at the point, ma'am, huh? So just follow it, ma'am. Don't worry, ma'am. I will poke you, ma'am. Okay, ma'am. So pupils do constrict and converge when the client focus on the near object. So next is to assess the corneal reflex, the cranial nerve, 7 or the facial. So now I'm going to use this cotton on ha. So I want you to look sidewards, ma'am. Yeah, turn ma'am. Again, ma'am, side. Okay, ma'am. So client's eyelids blink bilaterally. Now let's go to the ears. So first is to inspect the auricle, the tragus, and the lobule for shape, position, lesion, discoloration, and discharges. So ma'am, I want you to just stay still, ma'am, ha? Okay, the other side, ma'am. So ears are equal in size. The auricle aligns with the corner of each eye. Earlobes are smooth and attached. No lesions, lumps, discoloration, and discharge observed. Next is to palpate the auricle and the mastoid process for tenderness. So, ma'am, okay, ma'am, I want you to face it like here, ma'am. So, I'm first going to palpate your auricle, ma'am. Okay, ma'am, then your mastoid process, ma'am. Okay, ma'am. So there are no tenderness present. Now let's go to the test for hearing. So first is to perform whisper test. So, ma'am, I want you to sit properly, ma'am. So, ma'am, I am going to whisper you something, ma'am. So, tell me, ma'am, if you can hear what I am saying, ma'am, and you repeat what I say, ma'am. So, can you upload your right ear first, ma'am? 99.
99.
Okay, ma'am. The other ear, ma'am. Upload your other ear now, ma'am. Football.
Football.
Okay, ma'am. Thank you, ma'am. So the client can repeat the phrase that has been whispered. Next is to perform the Weber's test. So I am going to use this um, tuning fork. So ma'am, I am going to use this tuning fork, ma'am. So tell me, mama, just answer my questions na lang, ma'am. Do you feel any vibration, ma'am?
Yes, sir.
Now, ma'am.
Yes, sir.
How about now, ma'am?
Yes, sir.
Okay. So client can hear the tuning fork in both ears. So now let's go to the performing the rinse test. So ma'am, I'm always I am again using the tuning fork, ma'am. So just answer my questions, ma'am. Do you feel any vibration, ma'am?
Yes, sir.
How about now, ma'am?
Yes, sir.
How about now, ma'am?
Yes,
Okay, ma'am. Other side. Do you hear any vibration, ma'am?
sir. Yes, sir.
How about now, ma'am?
Yes, sir.
How about now?
Yes, sir.
Okay, ma'am. Client can hear the tuning fork in both ears. So now let's proceed to the nose and sinuses. So first is to inspect and palpate the external nose for color, shape, consistency, and tenderness. So ma'am, I am just going to inspect first your nose, ma'am. I'm going to palpate, ma'am. Okay, ma'am. So the color of the nose is same as the rest of the face. No discoloration and discharge. The structure is symmetric and is smooth. Now the next is to check the patency or airflow through the nostrils. So ma'am, can you occlude your right nostril, ma'am? So can you inhale, exhale. Okay, now occlude your left nostril, ma'am. The client can sniff through each nostril while the other one is occluded. Next is to test for cranial nerve 1 or the olfactory. So, ma'am, I want you to close your eyes first, ma'am. So, ma'am, I am going to let you smell something, ma'am. So tell me, mama, if you familiarize this smell, ma'am. So can you occlude first your right nostril, ma'am? Can you tell what is this, ma'am?
Alcohol.
How about this, ma'am?
Perfume.
Okay, ma'am. Next, ma'am, occlude now your left ear. Still, ma'am, remain your eyes closed.
Perfume. Alcohol.
Okay, ma'am. Can now open your eyes, ma'am. Client was quick to recognize the scent I placed in front of her nose. Next is to inspect for fluid or pus. So, ma'am, I want you to face over here, ma'am. I'm just going to check, ma'am, for your nose. So, can you, okay, ma'am. So, next is the mouth and throat. So, first, I am going to don gloves. So, first is to inspect the lips for consistency, color, and lesion. So, ma'am, can you face over here, ma'am? I'm just going to inspect your lips, ma'am. Okay, ma'am. So, lips are dry and pink without lesions or swelling. Next is to inspect teeth for number and condition. So, ma'am, can you smile broadly, ma'am? Okay, ma'am. Thank you, ma'am. Next is to check the gums and buccal mucosa for consistency and lesion. So, ma'am, I want you to open your mouth, ma'am. Okay. Okay, ma'am. You can now close your mouth, ma'am. So, gums and buccal mucosa are pink, moist, and firm. No lesions or masses observed. So, next is to inspect the hard or the anterior and the soft or the posterior palates for color and integrity. So, ma'am, I want you to open your mouth, ma'am, and raise your head, ma'am. Okay, ma'am, lower. Okay, ma'am. So, soft palate is pink in color, smooth, movable, and spongy. Hard palate is pale with transverse rugae, and no lesion is present. So, next is to ask the client to say ah and observe the rise of the uvula. So, ma'am, I want you to open your mouth, ma'am, and say ah.
Ah.
Again, ma'am.
Ah.
Ma'am. So the uvula is located at the midline and symmetrically elevated together with the soft palate. Next is to test for the cranial nerve 10. So touch the soft palate to assess for gag reflex. So again, ma'am, I want you to open your mouth. Okay, ma'am. Client's gag reflex is present and intact. Next is to inspect the tonsils for color, size, lesions, and exudates. So open your mouth again, ma'am. I am going to inspect your tonsils. Okay, ma'am. Thank you, ma'am. Tonsils are pink and symmetric. No swelling and lesions are observed. Next is to inspect the tongue for color, moisture, size, and texture. Inspect the ventral surface of the tongue for frenulum, color, lesions, and Wharton's tongue. So, ma'am, I want you to open your mouth, ma'am, and pull your tongue out, ma'am. Okay, ma'am. So, the tongue is pale, pink in color, moist, and have moderate size with papillate. So, the frenulum is pink and located on the midline. Wharton dungs are visible and moist. The client has no swelling, redness, or pain. Um, Next is to palpate for the tongue for any lesions. So, ma'am, I want you to open your mouth again, ma'am, and can you pull up your tongue, ma'am? I'm just going to palpate. Okay, ma'am, thank you, ma'am. I'm just gonna go forward. So there are no lesions present. So next is to test for the cranial nerve 9 and the cranial nerve 10. Assess tongue strength by asking the client to press tongue against the tongue blade. So here, ma'am, I have the tongue blade, ma'am. Okay, ma'am. I want you to pull out your tongue, ma'am. And I want you to resist the force, ma'am, with your tongue. Okay, the other one, ma'am. Okay, ma'am, thank you. So, uvula and soft palate rise bilaterally and symmetrically on phonation. um, Next is to assess the cranial nerve 7 and cranial nerve 9. So, have the patient close eyes. Check the taste by placing salt, sugar, and lemon on top. So, ma'am, I want you to first close your eyes, ma'am. So, ma'am, I am going to let you taste something, ma'am. So, tell me, ma'am, ha, if what flavor is it, ma'am? So, open your mouth, ma'am.
It's salty. I think it's salt.
It's correct, ma'am. Thank you, ma'am. You can now open your eyes. So, the client was quick to recognize and name the sample food I used.